Welcome to the Deep Dive. We're your shortcut to getting, well, properly informed on really critical topics. Today, we're diving deep into preventing drug use and smoking. The goal here is to arm you with some solid insights from research, from articles, give you knowledge, but also practical stuff you can use.
Exactly. And we're going to try and unravel, the science behind these psychotropic substances. We'll demystify addiction, which can seem really complex, look at the real impact of tobacco, and I think crucially, give you the skills to confidently resist negative influences. It's about understanding the what, sure, but also the deeper why behind these choices people make.
Okay, let's start there then. Psychotropic substances. What are we actually talking about here? How do they affect us?
Right. So at their core, psychotropic substances are basically chemicals that interact with your brain and nervous system.
Yeah.
They change your mood, how you see things, how you think, your behavior. And the big thing often is they can lead to dependence, physical or psychological. They kind of reshape how you relate to the world and even yourself.
Okay, let's break that down. The main types, starting with the ones that speed things up. Stimulants.
Stimulants, yeah.
Yeah.
They accelerate the central nervous system's activity. They flood the brain with certain chemicals, neurotransmitters like dopamine, norepinephrine, the messengers between nerve cells. This surge, it leads to things like increased heart rate, higher blood pressure, makes it hard to sleep, causes anxiety, and sometimes this false sense of being stronger or mentally sharper than you are.
And the sources mention some clear examples. Caffeine, which is khat, cocaine, phenethylene, captagon, methamphetamine, and nicotine, of course. Now, here's something interesting. Let's talk about caffeine. A stimulant lots of us use every single day, maybe without thinking much about it.
Yeah, caffeine, it's everywhere, right?
Yeah.
Coffee, tea, chocolate, lots of soft drinks. It is a central nervous system stimulant. Directly affects your brain's nerve cells. And what's interesting, even though it's totally normal socially, the way it impacts brain chemistry, especially dopamine, it actually shares some surprising things in common with, more serious stimulants. It can subtly tweak those reward pathways over time. Makes the natural good feelings maybe a bit less effective if you're constantly taking it in. If you go over, say, 300 milligrams a day, you can definitely notice effects, like more neurotransmitter activity, feeling more alert, the familiar faster heart rate, higher blood pressure, and needing to pee more often.
Okay, so from speeding up, let's go to the other end. Depressants, what do these do, and why are they, dangerous?
Right, depressants, like the name suggests, they slow down the central nervous system. They usually boost GABA, which is a neurotransmitter that chills the brain out. So the result is, less alertness, feeling drowsy, slurred speech, confusion, coordination gets worse. And in more serious cases, they can slow breathing and heart rate way down, which unfortunately in an overdose situation can lead to unconsciousness or even death.
And common examples there.
Yeah.
Alcohol, right? Benzodiazepines like Valium, Xanax, barbiturates, and opioids, heroin, morphine, stuff like that. Okay, so we've got uppers and downers. Now, what about altering perception? Hallucinogens, how are they different in how they affect the mind?
Hallucinogens are distinct, yeah. They really mess with perception, thoughts, feelings. They tend to interact with serotonin pathways in the brain. Serotonin's key for mood, sleep, sensory stuff. So this interaction, it can warp reality, cause really intense hallucinations, seeing or hearing things, delusions, paranoia, big mood swings, too, often unpredictable. They don't just speed up or slow down. They kind of reroute how your brain processes information entirely.
And the sources give examples like LSD, mescaline, and psilocybin magic mushrooms. Thinking about all these different effects, what happens if someone tries to stop using these things? What does that withdrawal look like?
Withdrawal. When someone stops, their body and brain have adapted to having the drug around. So they react. That's withdrawal symptoms. They vary a lot depending on the drug, but common ones are feeling restless, anxious, shaky tremors, sweating, nausea, vomiting. In severe cases, you can get seizures, hallucinations, paranoia. It's really tough. These symptoms are a massive part of why quitting is so hard. Shows how powerful that dependence, physical and psychological, can become.
Which brings us right to addiction itself. It's more than just, using too much, isn't it? How do doctors actually define addiction?
Yeah, it's defined as a chronic, relapsing brain disease. That's key, a brain disease. It's characterized by this compulsive drive to seek out and use a substance, even when you know it's causing harm. It's like a deep-seated need, a compulsion. Your brain and body get physiologically hooked, and it changes your behavior, your choices, everything.
And it's not all the same, right? Can you walk us through the different kinds or maybe stages of addiction?
Absolutely. The sources point to three key aspects. First, there's physical addiction. That's when your body physically adapts to the drug being there. Stop using it, and you get those nasty withdrawal symptoms because your body's struggling to adjust back. Second, psychological addiction. This is more about the intense craving, the emotional need for the drug to feel okay mentally. You might feel like you need it just to function normally day to day. It's a deep emotional reliance. And finally, there's behavioral addiction or problematic use. This is often where it starts. A pattern of using that causes real problems, distress. And the danger is this initial pattern can slowly, sometimes sneakily, lead to full-blown physical and psychological addiction.
It's fascinating, though, why one person might develop an addiction and another doesn't, even if they try the same thing. What makes someone more vulnerable or, more resilient?
That's a really critical question. Several things play a role. Risk factors, things that make you more vulnerable, include genetics. If addiction runs in your family, your risk might be higher. Then there are environmental things. Peer pressure is huge, obviously. Social influences, maybe not enough parental guidance when you're young. Starting substances early is a big risk factor too, because the developing brain is just more susceptible. Also, having other mental health issues like depression or anxiety can make someone more likely to self-medicate with substances. And, simply, how easy it is to get drugs in your environment. That's a practical risk. On the flip side, protective factors, things that build resilience, include strong family connections, having positive role models, good communication skills help, healthy self-esteem, being involved in healthy things like sports or hobbies, and just being aware, truly aware, of the downsides of substance use.
And the brain itself, how does it get trapped in this cycle? You said it's like being rewired?
It really is like rewiring. The brain's reward system is central here. When you use certain drugs, they cause this huge, unnatural flood of dopamine, the pleasure chemical. It overwhelms the brain's normal reward circuits. Over time, the brain adapts to these crazy high levels. It starts producing less dopamine naturally, and you get less pleasure from everyday things. So you end up needing more and more of the drug just to feel okay, or even just normal. It's a physiological trap. Makes stopping incredibly hard because your brain chemistry has literally changed, and it's scrambling to find that artificial normal again.
Okay, let's shift focus a bit, specifically to tobacco. Something we see everywhere and maybe underestimate its power.
That's right. And the key thing to grasp is nicotine. That's the highly addictive chemical in tobacco. People focus on the smoke, the tar, but the dependency. That's driven by nicotine.
And it's not just cigarettes anymore, is it? What are the different ways people use tobacco now?
No, it comes in lots of forms now. You've got smokeless tobacco, chewing tobacco, snuff, absorbed through the mouth or nose. These have really high nicotine levels and carry major health risks, especially nasty oral cancers. Then, yeah, cigarettes, still the most common way to smoke tobacco. Full of nicotine, but also tar, carbon monoxide, tons of other harmful chemicals from burning it. And then there are e-cigarettes or vapes. These electronic things heat up a liquid with nicotine and other chemicals, creating vapor you inhale. Often marketed as safer, especially to young people, but they still deliver harmful stuff and, crucially, that addictive nicotine. Big concern there.
Which brings up a really important question. What are the actual health consequences? Short-term, long-term, it seems to affect almost everything.
Oh, it does. The immediate effects, they happen fast. Increased heart rate, blood pressure goes up. Yeah. Bad breath, stained teeth. Your sense of smell and taste can get dulled. And respiratory issues, coughing, feeling short of breath. But the long-term consequences, they're really devastating. We're talking chronic lung diseases like bronchitis, emphysema, hugely increased risk of lung cancer. Cardiovascular risks shoot up, heart attack, stroke, high blood pressure, peripheral artery disease, which affects blood flow to your limbs. Oral cancers, lips, tongue, throat are a major risk. Gum disease too. And it doesn't stop there. Bladder cancer, pancreatic cancer, impotence. It weakens your immune system and even accelerates skin aging. Makes you look older.
And it's not just the person smoking who's affected, right? What about secondhand smoke?
Absolutely. Secondhand smoke is the smoke non-smokers breathe in from burning tobacco or from smokers exhaling. It's like an invisible poison. It contains over 4,000 chemicals, and about 300 to 400 of those are known toxins. It poses serious health risks for non-smokers. Especially kids, they're more vulnerable to respiratory infections, asthma, even SIDs, sudden infant death syndrome.
Wow. Given all that, it's actually incredible how quickly the body starts to recover when someone quits. Can you walk us through that timeline? What changes happen and when?
The body's ability to heal after quitting is genuinely remarkable. It starts almost right away. Within just 20 minutes, your heart rate and blood pressure start dropping back towards normal levels. After 8 hours, the carbon monoxide level in your blood returns to normal. That's a big deal for oxygen transport. Within 24 hours, just one day, your risk of having a heart attack already begins to decrease. Fast forward 2 to 3 weeks, your lung function can improve by up to 30%. Circulation gets better too. By 9 months, things like coughing and shortness of breath usually decrease significantly. You start breathing easier. After 1 year smoke-free, your excess risk of coronary heart disease is half that of a continuing smoker's. Half. At 5 years, your stroke risk can fall to that of a non-smoker. And the risk of cancers of the mouth, throat, esophagus, and bladder are cut in half. Kidney cancer risk decreases too. By 10 years, your risk of dying from lung cancer is about half that of a person who is still smoking. Risk of larynx and pancreatic cancer also decreases. And then 15 years after quitting, your risk of coronary heart disease is back to that of a non-smoker's. Your risk of death from lung cancer is similar to someone who never smoked. It really shows the body's incredible power to heal. It's never too late.
That timeline is incredibly powerful, isn't it? Beyond someone deciding to quit, what works on a bigger scale? Broader prevention strategies.
Yeah, it takes more than individual willpower sometimes. Societal strategies are key. Things like really good public education campaigns, making sure people understand the risks. Strict laws help too, age limits for buying tobacco, banning advertising, especially stuff aimed at kids, and promoting smoke-free environments, making that the norm. All of these things work together to reduce smoking rates.
Okay, let's switch gears now to something really practical. Empowering you, the listener, with refusal skills. What are they and why are they just so vital?
Refusal skills are basically your personal defense toolkit. They're the communication techniques you need to effectively say no when you're pressured or tempted to use substances. It's about being able to state your choice clearly, confidently, even when it feels awkward or difficult.
It's interesting that we talked about risk factors. Are there less obvious psychological triggers that might make someone more likely to give in or maybe stand strong even in the same situation?
Yeah, it's often subtle. Beyond the big risk factors like peer pressure or family history, things like chronic stress, feeling overwhelmed can definitely lower your defenses. A lack of solid knowledge about the real risks involved plays a part too. And sometimes it's just about access. If it's right there, it's harder to refuse. On the resilient side, protective factors like strong family support, positive role models you can talk to, having good communication skills yourself, feeling good about yourself, self-esteem, being busy with healthy stuff, sports, hobbies, and again, truly understanding the negative consequences. It's usually a mix of these things.
So let's get really practical. What are some specific, effective ways to say no when you're actually in that moment feeling pressured?
Right, these are skills you can use immediately. First, say no, clearly and firmly. Just a direct no or no thanks. Confident voice, look them in the eye. No maybes. Second, give a reason or excuse. Keep it short. No thanks, I don't do that. Or, nah, got a game tomorrow, need to be sharp. Third, suggest an alternative. Offer something else healthy to do. No, but hey, want to grab a coffee instead? Or how about we shoot some hoops? Fourth, change the subject or walk away. If they keep pushing, just switch topics or physically leave the situation. Just remove yourself. Fifth, avoid risky situations. If you know certain places or people usually involve pressure, just steer clear beforehand. Be proactive. Sixth, use humor. Sometimes a lighthearted joke can deflect the pressure without a big confrontation. Depends on the situation, though. Seventh, act confident. Body language matters. Stand tall, make eye contact. Show you're serious and not easily swayed. Eighth, delay or postpone. Saying maybe later or I'll think about it can work to get you out of the immediate moment, but honestly, a direct no is usually stronger. And finally, super important, seek support. Talk to friends, family, a trusted adult. If you need backup or just want to talk it through, you don't have to handle it alone.
That really brings it home for the listener, I think. Why is practicing these skills so important, not just knowing them theoretically?
Practicing is key because it builds muscle memory almost. It builds confidence. So when you're actually in that stressful situation, the response comes more naturally. Our sources mentioned this study way back in 1955, actually, that really highlighted this. It showed how important practical methods were for teaching refusal skills to young adults, like 15 to 25-year-olds. The study basically said, knowing how to refuse, actually rehearsing it, practicing saying no in different ways is just as vital as knowing why you should refuse. It takes it from just an idea to a real, usable skill.
So today we've really taken a deep dive, haven't we? Understanding these psychotropic substances, the complexities of addiction, the serious impacts of tobacco, and most importantly, hopefully, empowering you with those crucial refusal skills. You've got a real shortcut now to being properly informed on something that genuinely affects well-being.
Yeah, we've looked at the science, how these things impact the brain, the body.
Yeah.
but also that incredible capacity for healing the body has. And connecting it all, it really emphasizes that knowledge. And being prepared, those are your best defenses. Against addiction, yes, but also just for reclaiming your health overall.
So here's a final thought for you to chew on. We've talked a lot about the power of saying no. But how can you take it a step further? How can you move beyond just refusing in the moment and actively cultivate a lifestyle of, let's call it, informed resistance, making choices consistently that don't just dodge harm, but actively build towards the long-term well-being and the future you actually want? Something to think about.